We have already suctioned our trach patient, so now we are going to clean the stoma and replace the dressing. You don't want to clean before you do suctioning because it's just going to get dirty while you're suctioning. So make sure you're doing it after. So I have knocked on the door, I've introduced myself, I've explained to my patient what we're doing, washed my hands, and provided for privacy. I have my trach care tray, hydrogen peroxide, and saline. I also have a biohazard bag. If your dressing has any blood on it, you want to put it in the biohazard. Otherwise, it can go in the regular trash. We'll go ahead and put gloves on. We'll loosen his oxygen device and pull down on his gown a little bit so that it's not in the way. You can leave the oxygen mask here. It creates a little bit of blow-by oxygen while you're cleaning. And then we will remove the old dressing. We're going to look at it for color and consistency of the drainage so that we can document that after. If it is soiled with any blood, make sure it goes in a biohazard bag. And we'll get rid of that. And we can remove our clean gloves. And we'll check our bottles, make sure that the expirations are within date. If they are opened, they should be labeled with the time and the date that they were open and initials. I'm going to open each one of them and put the caps next to them. I put my bottles on the far left of the table because I'm right-handed. So I will be using my right hand to remain sterile and my left hand will become not sterile. So when I am transferring my fluid into my container, I want it on my left side. Obviously, if you are left-handed, you'll be doing this on the other side of the bed. I'll go ahead and open our kit, making sure to only touch the edges. We have sterile gloves in here. So I'll put those on first. And set up our sterile field. Make sure you're placing this with the shiny side down on the table. And then you can pull out your equipment. We have 2 Q-tips that we will need here. A brush. We don't need these, so we'll just stick them off to the side. We have our pre-prepared split gauze, new dressing. And several 4x4 gauze pads. I like to fold them over in half and separate them. We also have trach ties, which we will not be using because we have a manufactured trach holder on here. We'll stick those to the side. Depending on your hospital policy, you may need to hyperoxygenate your patient. If they are not on oxygen already, they probably don't need it. So we will go ahead and lose the sterility of this hand and pour our fluid. Make sure not to go over your sterile field. Check your hospital policy with whether you should be using hydrogen peroxide or just saline. For our purposes, I'm going to use saline in the small area and saline and hydrogen peroxide in the larger one. Now I will moisten my Q-tips and my gauze. So I'll get one Q-tip in the hydrogen peroxide solution, one Q-tip in the saline solution, and then I will get one gauze in the hydrogen and saline solution. Squeeze that out a little so it's not dripping too much, and then one in just saline. I'm going to leave the other two dry so that I can clean after. Using my non-dominant hand that is not sterile anymore, I will twist to the left and pull that inner cannula out. It goes into the large section. When it has fluid in it, it won't jump out at you. Keep it in there, and using my sterile hand, I will grab the brush end here and transfer it to my non-sterile hand. Then I will use my sterile hand to pull the inner cannula out, kind of scooping the fluid in there so that it goes through. Over a trash can or a trash bag, clean the inside with this brush, making sure not to touch your non-sterile hand to your sterile hand. Once that's clean, it can go in the trash, and this will go into the saline. Rinse it a little bit, and then using your sterile hand, pull it out and replace. Okay. Now we will use our gauze to clean the top of the faceplate. So grab that one that had hydrogen peroxide and saline and clean around the outside, trying not to touch your patient's skin with your sterile hand. And then this will go in the trash. And rinse with the saline. And in the trash. And then underneath, you can lift up a little bit and clean with that Q-tip. Check the stoma for redness, edema, exudate. Once that's clean, that can go in the trash. And rinse with a saline. And with your sterile hand, move this out of the way. We'll place the new dressing. And at this point, just try to maintain as much sterility as you can, but you can loosen these trach ties if it's hard to get it underneath. And scoot that right under. Tightening them up before you're finished. Replace your oxygen mask. And then you'll take off your gloves, wash your hands, get rid of all of your trash, document the procedure, and remember your patient's safety by lowering the bed and raising the side rail.